Hello, my name is Niall McKay and welcome to Living with PSC, a podcast about the rare disease of primary sclerosing cholangitis. Now, PSC causes the bile ducts inside and outside the liver to become scarred, narrowed and eventually blocked, and leads to liver cirrhosis. In this podcast, we aim to dispel some of the myths about the disease. Welcome today, and I am delighted to be talking to Dr. Jerome Schofferman, who is a medical doctor. Dr. Schofferman, would you like to tell us a little bit about your personal story, how you came to your interest in PSC?
Yeah, thanks, Niall. I guess the easiest thing to say is I have had PSC for many years. I started out with ulcerative colitis back when I was a teenager and eventually had a colectomy and ileostomy for colon cancer. And several years after that, I started getting sick and was diagnosed with PSC. So I'm both a medical doctor where I treated a lot of chronic illnesses, particularly chronic pain, and I evolved into a patient. And when I got sick, my wife and I were looking for some form of support group, particularly an in-person support group, and weren't able to find one. And this was probably 10 years ago. So we started a PSC, actually an autoimmune liver disease support group. And that got me further involved. And eventually I learned about PSC Partners and did a little work with them. And here we are, Niall.
Wonderful. And, without getting too corny about it, but was it a case of physician heal thyself? Did you come to the medical profession because you knew what what acute illness was like?
Well, I came into the medical profession, I guess, because I always loved biology and particularly human biology way back in high school. And it was a series of fortunate events that brought me into the area of treating chronic pain and chronic illness. And it's a long story, but it led to a career that I really enjoyed. And I hope to say I've helped some people, and I've done some lecturing and writing on the subject, which has been very nice for me. I really found I could share some of the things I've learned over the years, and then eventually both as a physician and a patient.
Would you like to talk to us a little bit about the medical side of primary sclerosing cholangitis?
Well, I'm glad you asked that. I'm going to take that to mean the medical and psychological overlaps between the two. And I think that's a good question because there are many psychological or apparent psychological things that can appear in PSC, mostly toward later stage of illness, but also early depressive symptoms, anxiety disorder, and even post-traumatic stress disorder that we hear a lot about about the military, but we don't often associate with a chronic illness. So I sort of think it's important to realize that some of the psychological factors, particularly, as I said, depression, anxiety, and PTSD, are treatable. And it's important for patients to report these types of psychological responses to their physician, particularly late in the illness when some of the forms of depressive illness might even be related to some medical causes of it. And again, that's all treatable.
Why would a PSC patient suffer from PTSD?
PTSD, post-traumatic stress disorder, is usually defined as symptoms, often anxiety-type symptoms, that are related to a single traumatic event. And we don't often associate PTSD with a chronic illness, but there are several stages of PSC and other chronic liver disease illnesses that fit the diagnosis. of PTSD. For instance, when a person is first diagnosed with PSC, that alone is a traumatic event. From that point on, a person's life might never be exactly the same. So that's something that is sort of like hits you over the head with a potential change in life, not just the duration of life, but the way we might have to deal with an illness. And so waiting for the results. Is this going to be when that proverbial axe will fall and something bad is going to happen? Or is this just going to be another blip in my illness? So events where they get particularly ill, they sort of have a point of worsening, for lack of a better term. And that's very traumatic. What now? Will this progress? Will I deteriorate steadily downhill? So these are all places in any chronic illness, but also, of course, with PSC, that each time there can be a little mini or maxi trauma. And I always got the feeling, instead of getting used to it, each time I was waiting, it got worse, and I never really fully adjusted to it.
If you are actually in your illness, if the liver isn't performing, you're probably not at your most concentrated or sharpest. So sometimes it takes a bit of time to even realize what the symptoms are or what you're going through, doesn't it?
People ask me when I've talked about this, is this the way I should be responding? And there is no should in this. Everybody's different, and each of us has a different makeup, a different psychological background. And equally important is we're each at different stages of the PSC illness. I used to like the word acceptance, that we have to accept our illness, but I don't think we should accept in the sense that means give up, give in, give up. We have to make adjustments. We have to recognize that we have an illness and acknowledge that this is a potentially life-changing diagnosis and event. But acceptance doesn't mean conceding to the illness or giving up. There's still a lot of things we can do. As you said, we have to adjust, perhaps adjust somewhat downward, take care of ourselves a little better, eat a little better, get enough sleep. So the word acceptance has been thrown around a lot, but I don't know if it's the right word, because it might imply to people give up, go to the couch, and wait to die. And that's not at all what this illness is like. This illness is something we can deal with. We can partner up with our physician and learn about the disease, learn about PSC, and do what we can to stay as healthy as we can. Even though I agree with you, we're not going to think it away.
Yeah, and I think, if we have a broken arm, there's a time to do, physical therapy, and there's a time to let it heal, and, you might put it in a sling, or you might, but one thing you don't do is say, I don't have a broken arm.
Well, that's, you just raised an interesting point, which is the difference between an acute illness, an acute event, medical event, versus a chronic medical illness. Everybody has had an acute medical event, ranging from a sore throat, perhaps even pneumonia, things that get better either with or without treatment. We get a diagnosis like PSC, a chronic condition, and we don't really have any experience with a chronic condition, and it's different. So it's really important to maybe someone that's listening to this to realize that a chronic illness is not the same as an acute illness.
What are the ways that you feel is a good way to approach this? Because, what you were bringing up earlier was sort of the Elizabeth Kubler-Ross, wasn't it? Sort of 5 stages of grief or whatever that you go through. Is it similar for people with chronic illness?
Well, it is. Elizabeth Kubler-Ross, in a lot of ways, created a model that is just totally useful, and it's applicable to lots of other conditions, even though I don't feel like it's used in that same way. And as you implied, Elizabeth Kubler-Ross sort of defined these different stages um, and what she was very clear at, and I've met her and spent time with her, and she's very clear about the fact that these stages don't apply to everybody and they don't occur in a linear fashion. People will swing back and forth, to and fro between stages. A denial is usually the first one, and it's easy to know that you're sick. You have something wrong. Maybe you're even jaundiced, but the denial is sort of that this can't be a chronic illness. This can't be something that isn't going to just go away. I refuse to believe that. And then you sort of get angry, or you're mad. You don't know who to blame for this. Some people blame God, some people blame how they ate, but really they're angry. They have to, and they look for something or someone to blame, even though most of the time people blame themselves. So they're angry. And then some people who sort of are a little more passive in their coping mechanisms will bargain. I'll never say a bad word about anybody if only I get better. And then it leads to different stages, like I said earlier, depression. And eventually, most people come to accept or acknowledge or at least recognize that they have a chronic illness. And once they sort of get to that stage, it becomes, I guess, Niall, a little easier to move on. And I think it's useful to add that most people have a caregiver. And it's important to note that caregivers sort of go through the same stages with whoever the patient is, maybe not at exactly the same stage. They may not be in sync there, but it's important to acknowledge that there are at least two and sometimes more people that have to deal with this diagnosis.
I understand. Yeah, and in terms of what are some of the things that you advise patients to or people to do to help themselves in this situation?
Well, it's really again, there's no one size that fits all. My belief system sort of leads to communication, open communication between the patient and his or her caregiver and the rest of the family. But of course, it needs to be appropriate to, for instance, age of children, perhaps coworkers, because one of the worst, especially well, I found that communication is really one of the hallmarks of dealing with this well. One of the things, well, I shouldn't say one, but many of the things we've learned in our group, and we've been doing this group for a couple of years, is that several things come up that are that you wouldn't expect. They're not part of the psychosocial usual one that you deal with that you might read in a magazine or even a book. And the factors, recognizing the factors that come up. And what I learned in our group is sometimes people with PSC have never met another person with PSC, nor have even heard of it. And soon as people hear that they have a liver disease, they think, well, I didn't drink too much. I haven't been using needles. How could I have this? And they fail to quite understand that this isn't hepatitis. This is something totally different. And what I saw a lot in group, and stop me if I'm diverting too much from your goals, but you know what? The things that we hear a lot, and we hear it repeatedly, are some of the factors like isolation. Once you have a diagnosis like this, you feel isolated. And so one of the things is to learn about it, attending a PSC Partners group, podcasts, other forums. So learn about what this is, because it can be an invisible illness. Like somebody, like when I was sick, in between my episodes, I was normal. I felt pretty good. I didn't look sick. And then suddenly the next day I'd be in the hospital in the ICU. So it can be an invisible illness. And one of the things that's not so invisible is fatigue. A lot of people with PSC are tired all the time, and yet they don't look sick. So it is a weird thing. It's an invisible illness until it sort of flips over and becomes a very visible illness with jaundice at one extreme, cirrhosis with a swollen belly from later cirrhosis.
Do you feel it's better to kind of out yourself a little bit with having PSC, or better for people? I know there's no one size fits all, but do you think people fare better if they tell all those around them, or, you know?
Well, I think yes, with limits. People that you or I associate with fairly frequently, I think when the timing seems right, perhaps when you're having symptoms or have to leave some event early, I think that's a good time to disclose. I don't know if I like that word, but to tell somebody what's wrong with you. And when doing that, we have to be very careful to, as you sort of implied before, to differentiate PSC from all the from all the liver diseases that everybody's heard of, from alcoholism to the group of hepatitis, hepatidities, if that's such a word. So I think it is better to disclose, but you have to do that with clarity, because people are apt, as I said, to go to another dimension of liver disease. So I think it is good and can be really helpful. But there's a backside to that, or a downside to that, which happened to me, is that from then on, I became sort of the designated patient in my sort of family and social group. Would be like, how are you? How are you feeling? And I learned a lot about the phrase, how are you, which can be sort of a simple, really a common beginning of a discussion. How are you? Or it could be like, how are you? In sort of like an overly dramatic sense. And I've had it happen that I'd be sitting at a table with my wife and some others, and I've actually had people say to my wife, how is he? In almost a whisper, and I would say, hey, I'm here.
And so as a doctor, it's really great that you understand that,
Oh, yeah, it's really quite common. And I put myself in the position of being a doctor, and I've been very fortunate to have a very great hepatologist who talks directly to me and is very honest and open. But no physician likes to tell a patient that they have a chronic condition for which there is no cure at this time. Nobody likes to do that. No physician likes to say to a patient, you have cancer, for instance. So we have to recognize that physicians also are human, and they bring to the patient encounter their own stuff, their own baggage, the things that they're comfortable with. So if we recognize that, I think it goes a little further toward having a good communication with the caregiver.
And do you feel that things like counseling or, do you recommend stuff like that for people?
Yes, I think that counseling in any of its forms is very helpful to adjust. But I think also you have to find the right counselor or therapist. It has to be somebody who has some experience with chronic illness. When I was doing a lot of chronic pain work, if I referred a patient or the patient was self-referred, sometimes they would say, the therapist might say, when your pain gets better, your depression will lift. And when we're dealing with chronic illnesses, that is not the case. The illness is not going to go away and be better. So it is important. It can be very helpful for a lot of people to be in counseling or some form of psychotherapy, particularly group. Group has been really helpful for a lot of people that I've interacted with. But it has to be a psychotherapist or counselor who has some experience with chronic illness. And
so it's good not to overthink it as the source of everything.
That's a good way to say it. People can become hypervigilant and overthink it and attribute every minor symptom that they've had off and on for years and years before they ever had PSC can be attributable to the PSC.
But also, if one has a job that's predominantly physical, for example, it might be a good idea to kind of take a look at your life and figure out if you can, reduce that physicality down and, work with your illness in a way so that you're not really.
Well, that's an interesting thing that I hadn't thought of that phrasing. You sort of have to partner with your illness in a sense that, and this is perhaps a bit unrealistic, but if you can partner with your illness, sort of know what's going on and find the compromises that you would with anybody else with whom you're partnered, you might have a far better relationship and do better with your illness.
Are there other things that we didn't talk about? Is there that we should have talked about here?
It is important to have a physician with whom you have a good relationship. In some areas, you have a primary care physician, but many of us are lucky and we have access to a liver specialist. But you have to find a physician with whom you can communicate, because and be real. And you need a physician that will be real back to you so that you can be honest. And I think there's a lot of honesty in that communication that you need, because it is going to be a long-term relationship, and you have to sort of maybe not be best friends, but you sort of have to be like each other, at least eventually accepting or at least realizing and acknowledging that you have a chronic illness and you're going to need help to deal with it. Maybe not right away, but eventually establish a good relationship with your primary care and liver specialist early. Establish communication with your significant other and family and close friends so that they can either provide support, but at least understand what you're going through. Again, communication, honesty, team are really help people deal and cope with their illness.
And finally, was there an aha moment for you? Was there one moment that you can remember where you kind of went, I understand this in a way that I never understood it before? Or
well, yes. And in fact, the day I got a call that I had a potential liver transplant, I had just run 2 miles and was thinking about whether I should ride a little stationary bike. in my home when I got a call to say, well, we have a liver. And I said, what? I can't. I feel too good today. And I realized this is a real opportunity to get some long-term benefit. And I'll just say one word about liver, well, one sentence perhaps about liver transplant. It's a wonderful thing and can help a lot of people, but it is not a cure-all. It's really a trade of a chronic illness for a chronic treatment. That is medications for life, blood tests for life. But when you compare the illness to the chronic treatment, there's no comparison. So I feel fortunate. I'm probably about 5 years out now, and I feel fortunate to have had that opportunity.
If you're at a certain stage of the illness, the beginning stages of the illness, you might be lucky. We might have treatments in the future.
Yes, absolutely. And I think we will. We will have new treatments that will help people feel a lot better and maybe keep people functioning and very healthy for much longer periods of time.
Thank you very much. This has been really helpful. Well, I'm afraid that's all the time we have for this week. For more information about PSC and for a list of people and topics we'll be covering in the near future, please go to www.pscpartners.org. That's www.pscpartners.org. PSC Partners is a non-profit organisation dedicated to providing education and support to primary sclerosing cholangitis patients. There is information and resources on the website. There is a conference once a year. There is a private Facebook group that you can also join. Also, please join our patient registry. This is an anonymous database that provides research support to the medical community who are researching this disease. Thank you very much for listening.